Hello, people. This is Dr. Muskaan this side, and today I'm going to discuss one very beautiful case. It is all about cardiomyopathy. So let's dive deep into this case and enjoy. Here is 31-year-old female who has came to ER with chief complaints of abdominal distension and shortness of breath since 7 days. So what are the differentials of shortness of breath? I told you the mnemonics. If it is heart, it is FMT. If it is lung, it is P3A3C. So heart के लिए FMT is heart failure, MI and tamponade, and for lungs it is P3, that is pleural effusion, pneumonia, pneumothorax. A3 anaphylaxis, asthma and allergy, and C is COPD. On abdominal distension के differentials is fat, feces, flatus and flatus, feces, fat, fetus, है ना. Okay, so on arrival ABCS was done, airway, breathing, circulation, sensorium. Airway was patent, there was no signs of airway obstruction. What are the signs of airway obstruction? Hoarseness of voice, choking, not able to breathe while lying on the bed, not breathing with सांस नहीं आ रहा, पेशेंट ऐसे करता है, dysphagia, dysphonia, stridor. These all are the signs of airway obstruction which was absent in the patient. That means airway was patent. On breathing assessment, there was tachypnea and desaturation. So that means respiratory distress signs were present. What are the signs of the respiratory distress, my dear friends? It is gasping, gurgling, abnormal breathing. What is abnormal breathing? Either too fast breathing, either too slow breathing, too shallow or too deep breathing. Patient faces cyanosed or pale, है ना? So these are the signs of respiratory distress. On circulation assessment, there was hypotension and tachycardia. That means patient was in shock. सो सर्कुलेशन असेसमेंट से हम क्या देखते हैं? शॉक देखते हैं. 5 तरह के शॉक होते हैं, उसमें से सिर्फ न्यूरोजेनिक शॉक एक ऐसा होता है जिसमें ब्रैडीकार्डिया और हाइपोटेंशन मिलता है. बाकी जितने भी शॉक होते हैं उसमें क्या मिलता है हमें? Hypotension and tachycardia. On sensorium assessment, GCS was 15/15, E4, V5, M6. That means eye was opening spontaneously, verbal response was oriented, and on motor response he was obeying the commands. HOPI, patient was apparently well 1 week back when she started experiencing bilateral pedal edema. सो जब मैं थोड़ा सा डिटेल में आपको बताती हूँ, अगर पैरों में एडीमा मिलता है तो हमें दिल के बारे में सोचना होता है. अगर हमें चेहरे पे एडीमा मिलता है तो हमें पेट के बारे में सोचना होता है, किडनी के बारे में सोचना होता है मेनली. और अगर हमें GIT में एडीमा मिलता है तो हमें उसके बारे में सोचना होता है कि वहाँ पे साइटिस होगा. तो अगर ऊपर है तो किडनी, और अगर पैरों में है तो ऊपर हार्ट. ठीक है, याद रहेगा, मैंने ऐसे ही याद किया है. चलो, patient was apparently well 1 week back when she was experiencing bilateral pedal edema which was sudden on onset and non-increasing. Patient also complained of abdominal distension, gradually progressive in nature, not associated with nausea, vomiting, loose stools. Patient also complained of shortness of breath at rest. That means orthopnea was present, relieved on sitting, not associated with cough, chest pain, sweating and palpitations. Past history of the patient: she is known case of dilated ischemic cardiomyopathy with left ventricular ejection fraction 20 to 25% since 2 years, hypothyroidism since 4 months, and past surgical history of sterilization procedures 18 years back was present. Personal history: she was not vegetarian by diet. Her bladder habits were normal, but on bowel habits she was having constipation, appetite was decreased, there was no addictive potential of alcohol, smoking or tobacco. Menstrual history: she was having amenorrhea since 4 months. General history: decubitus, she was oriented to time, place and person. Vitals were within the normal limits from PICLE, PICLE, है ना. पैरेलल इक्टेरस, क्लबिंग, साइनोसिस, एडिमा, लिम्फोडेपेथी सब एब्सेंट थे एक्सेप्ट बायलेटरल pedal edema जो मैंने बहुत स्टार्टिंग में आपको बता दिया था. इन्वेस्टिगेशन पिक्चर: CBC shows anemia, KFT shows increase in urea and hyponatremia, LFT picture shows raised SGOT, SGPT, that means serum transaminitis is there. ABG picture shows respiratory alkalosis. HRCT thorax shows bilateral extensive miliary tuberculosis with mediastinal lymphnopathy and right pleural effusion. अरे बाप रे. So right pleural effusion, main blunting of CP angles हमें एक्सरे में मिला था. ओके, एडिनोसिन डीएमएनएज was increased which was 53.9 और नॉर्मल जो होता है वो लेस देन 40 होता है. और अगर एडिनोसिन डीएमएनएज का लेवल बढ़ा हुआ होता है तो वी think about some tubercular component in the fluid present in the body. Okay, Troponin I plus का level was less than 0.201 nanogram per ml. AFB stain shows no acid fast bacilli. Iron profile shows decrease in iron, decrease in transferrin, and increase in TIBC. That shows iron deficiency anemia. Vitamin B12 level was also raised. Echo report shows severe LV dysfunction, global hypokinesia, mild MR, mild TR, and trace AR. Urine microscopy was normal. Reticulocyte count was increased. It was 3.5%, and normal reticulocyte count is less than 2.5%. So what are the differentials of raised reticulocyte count? That is hemolysis, hemorrhage, leukemia, pregnancy, recovery from vitamin B12, folate, iron deficiency, sickle cell anemia. Pleural effusion was having 3.2 gram per dl protein, which is less than 3.5 gram per dl. That means it was transudate in nature. NT-proBNP level was raised. That means there is some cardiovascular disease. I have told you n number times about NT-proBNP, but I am going to again repeat. NT-proBNP is N-terminal prohormone brain natriuretic. What it is, brain word इसलिए आता है क्योंकि पहली बार ये ब्रेन में मिला था. natriuretic means यूरिन और पानी. तो जब भी हमारे लेफ्ट वेंट्रिकल में स्ट्रेस होता है तो स्ट्रेस होने की वजह से ये एक प्रोटीन है जो ब्रेक डाउन हो जाता है, जिसकी वजह से ये इसका इफ़ेक्ट आपकी किडनी पे दिखता है और बहुत सारा पानी और सोडियम बाहर निकलता है बॉडी से. सो दिस इज़ NT-proBNP. ठीक है, ये बेसिकली हमें बताता है कि देयर इज़ सम रिस्क ऑफ कार्डियोवास्कुलर प्रॉब्लम. HbS-AG, HIV-1-2, HbC, ठीक है, ये सब नॉन रिएक्टिव थे. अल्ट्रासाउंड एब्डोमेन में ये बताया था कि देयर इज़ प्रोमिनेंट हेपेटिक vein, gross splenomegaly, medial renal disease, myelicitis, bilateral pleural effusion on the right side more than the left side. Chest X-ray shows pleural effusion, है ना. ट्रांसुडेट 3.2 था. तो कॉजेज क्या है ट्रांसुडेट प्लूरल एफ्यूजन के? हार्ट फेलियर, सिरोसिस, नेफ्रोटिक सिंड्रोम, हाइपोएल्बिनीमिया एंड हाइपोथायराइडिज्म. ठीक है. सो और पेशेंट के पास ऑलरेडी हाइपोथायराइडिज्म की हिस्ट्री है जिसके उसको ट्रांसुडेट प्लूरल एफ्यूजन होगा. सो डिफरेंशियल्स क्या बनेंगे अब? इश्केमिक कार्डियोमायोपैथी. कौन से पॉइंट्स फेवर कर रहे हैं इश्केमिक कार्डियोमायोपैथी को? देयर इज पास्ट हिस्ट्री ऑफ हार्ट डिजीज. इको रिपोर्ट शोज ग्लोबल हाइपोकाइनेसिया. MR, that is mitral regurgitation, is present. Right ventricular dysfunction is absent. Bilateral pededema is present, which is present in the heart patients mainly. Second positive differential can be miliary tuberculosis, because HRCT reports confirm the diagnosis of adenosine deaminase levels are HRCT confirms the diagnosis of miliary tuberculosis. Secondly, adenosine deaminase levels is also raised, which predicts the tubercular fraction in the fluid present in the body. Third differential is your pleural effusion, which shows exudate fluid less than 3.2. Chest X-ray also supports the diagnosis by showing the blunting of angle. Hypothyroidism which shows the report, and she's also having past history of hypothyroidism. Iron deficiency shows the iron profile. तो पूरा का पूरा probable diagnosis क्या बन गया? Ischemic cardiomyopathy with miliary tuberculosis, with pleural effusion, with hypothyroidism, with iron deficiency anemia. Now I'm going to discuss management. Tablet Theranom was given, which was the treatment for Theranom. Tablet Ecosprin was given, which is antiplatelet, which prevents heart attack. Syrup Dexorange is given, which treats iron, vitamin B12, folic acid deficiency. ठीक है, ये एक सिरप होता है Dexorange. Tablet Limcy is given, which is given for vitamin C deficiency. Tablet Met-Exil was given, which is treatment for angina. Syrup Loose was given, which is treatment for constipation. Tablet Eldecton, which is spironolactone, is given, which is diuretic in heart failure. Tablet ethambutol is given, which is anti-tubercular therapy drug. Tablet moxifloxacin is given. Moxifloxacin is given, which is also anti-TB मतलब drug, which is second generation है ना. Tablet ivermectin is given, which is treatment for angina. Tablet Medrol is given, which is methylprednisolone, which is treatment for swelling. Tablet Diator was given, which is treatment for excessive water in the body. Tablet Midodrone was given, which is treatment for hypotension. Ensure protein powder was given, which is nutrition purpose. Tablet injection streptomycin was given, which is anti-tubercular therapy again. So yes, that's all. I hope you have gained some knowledge after listening to this case. Dr. Muskaan Bansal is signing off now.